Hey guys, it's Chris Dewey from May River Medicare with the single biggest announcement in our company's 13-year history. Our technology department designed a Medicare supplement tool that lets anyone in all 50 states actually shop rates. All meaning every supplemental carrier will pop up from lowest to highest rate in your county. It even empowers you to see if you're eligible, meaning healthy enough to change into a supplement. Because let's face it, after 6 months of being on Medicare Part B, you're going to have to start answering medical underwriting questions, and they're going to do a medication history check on you. But first, understand Medicare plans are standardized by Medicare, meaning a Plan G is a Plan G no matter what company you choose. The benefits are identical, coverage identical. The only real difference, monthly premium cost. Most states, insurance companies are going to determine their premiums based on your age, your gender, your zip code, and your tobacco. So let's take a look. Same coverage, big difference in cost. That's why it's key to work with an independent broker who's licensed from nearly all carriers in your area. So let's take a look. All right, guys, here's my website. But when underneath this video is a link, and you click anything, it's going to take you right here to our preliminary application page. So there's different options. Let's go with, I've got a supplement I want to find a lower rate. You're going to click on that. There's a video about the Plan N versus Plan G that you can watch. I like the Plan N better. And then you're going to click. Let's go with the Plan G. We're going to do an example of a 73-year-old right here. So after you click on Plan G or Plan N, it's going to take you right here. We went with the Plan G. I'm 72. I'm non-tobacco. I'm a male. I'm in Hilton Head Island. So I'm going to click Get Quote. And that's going to take me right here. Now, the lowest price one is Humana at $120. Keep in mind, that goes down to $112 because, 106. They give a 12% household discount if you live with anybody over 50 years old. All right? So we can go through. I personally like Medico better. They give a 10% discount if you live with anybody over 50. That takes you down to $112 a month. But here's different insurance companies charge different premiums right here. So for a 73-year-old, we can get you down to $112. Look at this, guys. Same exact person. And you can flip through these. State Farm, $191. United Healthcare, $192. Blue Cross Blue Shield, $193. And they give a whopping 5% discount. So let's just say $184 with a household discount versus $112. They don't have a household discount button, but it is 10%. All right? So we're going to click See If I Qualify. All right, once we hit See If I Qualify, boom, great choice. You can read about the zip code, the gender, the tobacco status, and it tells you a little bit about how we do things. Now, almost done. We have a few health questions. We need the health questions. We need the Medicare information. It's the only way. It's full underwriting. You have a supplement. You want to change it. Got to have your Part A, Part B dates. If we don't have that, we can't apply for you. You got to have A and B to get a supplement. Now it's just a matter of filling out your name, your birthday, and we will not call you. If you set up an appointment for us, we will call you, and I'll show you that in a second. But yeah, you're just going to fill this. Very self-explanatory. I wish I was 200. I'm 210. Next, and you're going to put got to be on Medicare to get a supplement. So we need your Medicare card, your Part A and Part B dates one more time. I know it's redundant, but we asked for it twice. We can email you or mail you your outline of coverage, all that good stuff. Now we're going to ask if you have Medicaid. Now Dr. Zhivago is my primary care doctor. And we're going to ask you some health questions. If you're not sure, don't worry about it. This is a preliminary application. But you're going to click Next. You're going to put down your meds. I only take lisinopril. I don't take anything. I probably should be on lisinopril. So you're going to put your meds. If you can't spell it right, you're not sure the milligrams, just do the best you can. It's a preliminary application. All right? Now this is big. If you want us to call you, schedule the appointment. Click Continue. And you're going to go right to this calendar, and you can pick a day. Let's do the 24th. Is that what I picked? Yeah. You pick a time, and you just keep going. You put your information in. You'll get a reminder, and it's really that simple. So in conclusion, you go to Medicare. You click the link below, or go to mayrivermedicare.com, or go to supplementquote.com. We got a couple websites. Supplementquote.com, mayrivermedicare.com. Bottom line is, you set up the appointment, we'll call you. You don't set up the appointment for me to call. I don't know why you wouldn't, because I just want to go over the application, make sure it's in good order. I want to make sure that based on your drugs, doctors, your health conditions that we find a company that looks at your health conditions most favorably. Different insurance companies look at your health conditions differently, just like they charge different premiums for the exact same plan. So I challenge you. I had my dad. I said, Dad, I want you to try out my new software. He went to the wrong website. They said, get your free quote. When you see get your free quote, you kind of want to run, because what happens is they're going to ask for your information, your name, your email, things like that. And all they do, they take that information and they farm it out to 10 or 11 agents. The poor guy got phone calls for like 4 days in a row from everybody and their mother. I don't do that. Bottom line is, we're the only company that has your information. It's in our database. It's bank encrypted security. It's safe. We're not going to call you unless you fill out the whole application and set up an appointment with us. This information is not going to be sold or given to anybody. But again, my dad had like 20 calls. I challenge you, there is not a company in the United States right now that is so transparent, they're going to let you see every single Medicare supplement from lowest to highest. There's not one in the country. We are the very first company to do this, and I challenge you to find a company. But be careful. These free quote companies, they're going to take your info and they sell them as leads to insurance agents like me. I think that's horrible. You get bombarded with calls. Most of these people are trying to sell you Advantage plans. We get paid $600. Someone turns 65. We get paid $611 for a zero premium Medicare Advantage plan commission. With a Medicare supplement, the insurance company pays us separate. We get paid 22% of the annual premium. I showed you earlier, for Plan G, we can get you right down to about between 106 and 112. Let's just run it off to 100. You guys can do the math. So I get paid $220. You don't pay me. It's like home or car insurance. The insurance company pays me separate. Whether you go to a different carrier, whether you do it on your own, whether you go direct to the carrier, your rate's going to be the same, okay? But working with an agent and advocate like me, we can help you with claims, help you find your drug plan every October. We do a lot of extra stuff. So you guys have a great day. It's Chris Dewey from May River Medicare.